Being here. I'm a nurse of 6 years, and I wanted to just talk about today what to do in your downtime. So you've been a nurse on the floor for maybe a little while, and you're gonna get a day or a couple where it's actually slower, where you can actually get caught up on the stuff on the floor. And what I mean by that is there's always something to do. You shouldn't be sitting around and chatting. Yet, there are times for that. You are going to get burnout, and you're going to have a night where you want to say, let's just chill this night and tomorrow night we'll stock or whatever. Now that's where I was going with this, is that when you have downtime, stock the unit. Get ready for your next stuff coming in. I work in a labor and delivery department, and babies are born all the time. There's never a time that there isn't somebody on the floor, but there are nights where it's slower and we can get things done. So we stock our triage cart, we stock all the rooms, we stock all the linens and all the supplies, all the warmers, all the monitors and whatnot. And we do kind of inventory what's broken, what's not broken. And then we go in the ORs and make sure we got enough stuff for cases. Other things you can do in downtime is Google. If your internet does work at the hospital, Google some stuff that you've had questions about, or go through some certification courses if you have to catch up on your NRP, which is neonatal resuscitation, or your ACLS, advanced cardiac life support, and you have to study for that kind of stuff. Start doing it then. A lot of places make you do different competencies for the unit. We have something called net learning at my job, and we have to log in every once in a while and complete all the net learning stuff, and we have a list of every time we log in. So that's stuff you can do on your downtime. We have a bunch of medical books around our unit, a lot of OB books to read through, and I encourage a lot of my new people to do that. This isn't a time to just sit down and look at the schedule and think of, who got the best schedule, who doesn't work enough weekends and whatnot. It's very important to actually, take care of your unit. That's why you're there. That's why you're getting paid to do that. So my job, I'm an assistant manager, so I do a lot of office work on my downtime. If I get downtime, I usually am the one running around getting things ready. The other thing I always do is tell all the girls to get a room ready at all times, and everybody's in charge of one room a night. So therefore our rooms are always ready for the worst, or just whatever comes in the door. The other thing you can do on your downtime is look up stuff that you've never heard of. I have a bunch of OB books in my office, so I'll pass them out to everybody and tell them to kind of look things up sometimes. And this is time to do mocks. So what we'll do, I'll say, you guys, let's do a mock code here on, if somebody coded, or if there's an emergency that walks through our door, placenta abruption, placenta previa, twins, or a very fast labor, what would you do? And this helps we do a lot of running to the OR, because in a crisis, that's what you got to make sure you know, and the right steps to take. And it being new, sometimes it is hard for people to think about prioritizing. So doing mocks and doing drills like that really helps people in the long run, and they end up thanking me later on. Other things I do, since I'm allowed to be off the unit if I don't have a patient, is I'll go down to our medical library and I'll look things up for people and bring back some things that I find, and that helps. I'll look through the journals and look through the medical books, and that helps everybody too. The other thing you can do is your CEUs. There's a lot of websites out there that offer CEUs, and you can start, because you need 24 every 2 years for you to maintain an RN. Now, if you do get certified, like my RNC, I need 45 in my specialties. So, you do have a lot to catch up on. And if your work does anything like a clinical ladder or anything, that's something you can start getting work on. So those are just some ideas what to do in downtime. I hope you get some, because in our unit it is hard to come by, but when we get it, you got to take advantage of it and really get to work. And if you work 12-hour shifts, this will definitely take up all of your time on the shift.